Hello, my name is Victoria Garcia from Group 46. My teaching presentation is on humeral shaft fractures. Humeral shaft fractures account for 3 to 5% of all fractures. Now, there is no specific age group to get these fractures, but there is a bimodal distribution. So, it is most common in males in their third decade and most common in females in their seventh decade. There is 3 different types of fractures that can occur. One being a transverse fracture, which is usually common when there is a direct blow to the arm. The other 2 are oblique and spiral fractures, which are most common in a twisting action or falling. The following image is a transverse fracture. As you can see, the bone is completely broken. Now, this next image is an image of a complete spiral fracture. This is the fracture that is most common in falls and in sports. Since humeral shaft fractures are usually considered trauma, there is 3 different types of images we must obtain. We must obtain a shoulder image, a humerus image, and an elbow image. That is to assess for proximal or distal extension of the fracture. Now, it would be ideal to receive an AP, oblique, and lateral image of the humerus and elbow, and an internal and external and a wide shoulder. Scapula. Now, since they are trauma, it is a lot harder because you should not move the patient from the way they are. You'll usually receive the patient in a sling, therefore you cannot do extension of the arm. For the shoulder, it is possible to get an internal and an external and a Y. It is just very hard. For the humerus, you can obtain the AP, the lateral, and the oblique. Where it comes tricky is the elbow. You cannot move the arm from where it is. So if it is in a sling, the only way that you can really obtain an image is a lateral image of the elbow. An AP is very ideal, so you can see the fracture in all angles. It is just very hard and difficult. You should not move the patient. The technical factors that you would be using on the images would be a 70 kVp on elbow and an 80 kVp on shoulder and humerus. For the shoulder and elbow, you will be using a 10 by 12 IR and the humerus an 11 by 14 IR. And make sure that you call me. On all 3 images, there is a minimum SID of 40 inches. So in conclusion, humeral shaft fractures are pretty common. They account for 3 to 5% of all fractures. There are 3 different fractures that fall in this category. That would be a transverse, oblique, and spiral fracture. Each must be handled with care because they will be, and usually are, considered trauma.